Hello and welcome to Respiratory Rounds. I'm Rupam Sahajpal. I'm a respiratory specialty trainee in London, and today's presentation is about cracking the SCE respiratory medicine exam in first attempt, some tips, strategies, and must have resources. In this video, we'll look at the exam format, curriculum for the exam, the books that are high yield for the exam, question banks, and courses which are available. We'll discuss some exam strategies and some important guidelines which you should not miss. And in the end, I will highlight some useful links for you to go and update yourself. Exam format. So this is an computer-based exam. It consists of two papers. You will sit paper one in the morning and paper two in the afternoon. And each paper will be 3 hours long and consists of 100 questions, which are multiple choice based. And you have to pick best of the five, one answer. There is a 1 hour break between the papers. And each question has a clinical scenario, it has a clinical stem, it can also have an image and some interpretation of a lung function test, or it can be interpretation of some blood results. And it will be followed by five answers, and there will only be one best answer for each question. Though there is only one best answer, it's very important that the other options can sometimes be partly correct, but we need to eliminate and find out what answer suits the question in the best possible way. Scoring and results. This exam has no negative marking. Each correct answer has 1 mark. The pass mark is set according to the standard setting and varies slightly each year, but usually is between 60 to 65%. Results are released in 6 to 8 weeks after the exam. For further information about scoring and results, you can visit www.thefederation.uk, and it has specific information about specialty certificate exam in respiratory medicine under its sections. Very important to familiarize yourself with the curriculum before starting preparation for the exam, because this exam focuses on certain areas in depth, especially airway diseases, thoracic oncology, and pulmonary infections. Interstitial lung diseases and diseases of pleura mediastinum also carry a major chunk in the exam. It's important that you are thorough with pulmonary vascular diseases, CPET interpretation, and interpretation of right heart cardiac catheterization in relation to pulmonary hypertension. There are questions in the exam which are related to sleep related breathing disorders. They also ask us questions from lung transplantation, statistics, pharmacology, imaging, and latest medications. Though the exam does not go into in depth about ITU, but there are certain questions targeted towards critical and high dependency areas of respiratory diseases, especially viral illnesses and ARDS. Looking at the resources which are available, the main ones which I used were Oxford Handbook of Respiratory Medicine and the 300 Single Best Answers MRCP SCE Handbook by Dr. Laura Jane Smith. I found the question bank book very, very useful. I started my preparation with that. It gave me a blueprint around which I built my preparation. I would go back and refer the topics in Oxford Handbook and read them in detail, and then if needed I would go and read them in another textbook. I would refer Murray and Nadal to clarify any doubts if I had. These two books are a great combination to start the exam preparation, and they give us in-depth knowledge and concise knowledge, which is not very time consuming to begin with. Certain question banks which are very useful. The MRCP website under the specialty certificate exam for respiratory medicine has a 100 question mock exam. You need to register for it. It's free of cost, and they send you a code every time you need to access it. It's a good resource. It allows you to understand the type of questions you will have in the exam, and it's a very, very useful resource. Other thing that you can subscribe to is BMJ1 exam. It has around 190 respiratory questions. I had mixed feelings about it. The questions, some of the questions were very easy and did not replicate the type of questions I encountered in the real exam. Study PRN is another popular resource which my colleagues have used in preparation for this exam. Regarding courses, these are the two most important courses which I have used, and my colleagues have also endorsed, and seniors have endorsed. The first one is the BTS Preparing for SCE online course, which I found very, very useful, very high yield, especially for lung cancer, radiology, pulmonary hypertension. The lectures are very, very high yield. And they also conduct an online mock exam on the same day, and that gives you a decent assessment of how your preparation is going. And it also gives you a recorded version of the course which you can access till your exam date, which I found very useful. The other course is the Royal Society of Medicine Respiratory SCE preparation course. This is a more in-depth, slow course over a period of 10 weeks. I found it useful. It allowed me to have a consistency towards my preparation. Some of the topics, again, asthma was well covered, occupational asthma, occupational diseases, pulmonary hypertension, CPET, infections, sleep, they were well covered in this course. And since you get one lecture per week, which is of 2 hours, you can have a pace to your preparation. Again, you also get recorded version of all the lectures which you can access till your exam is over. Then talking about guidelines, exam is based on guidelines, and most of the questions would expect you to know the guidelines to get the correct answer. I've highlighted some of the important guidelines which are useful, especially the Pleural Disease BTS 2023 guidelines, the Lung Cancer guidelines, and the BTS Sign 2024 Asthma guidelines are very important. It would be important to know what are the criterias for lung transplantation, pulmonary hypertension criterias, and certain criterias for interstitial lung diseases. So it would be important to make some flashcards or have a strategy how you can remember these guidelines, and because many questions will be based on these. Exam strategy wise, I would say reading the question slowly and carefully is very important. Sometimes we can misinterpret the question if we are in a hurry, and we should try to understand what actually they want us to answer. Then eliminate obviously wrong answers and think about applying guidelines to each and every question that you see. And if you don't know the answer to the question, don't wait and just flag it, because the online format gives you an option to flag and come back to that question later and try to answer the questions that you know in the first go. Top tips, I would say stay consistent, believe in yourself. That's very, very important. It's a doable exam. You just need to have a strategy and a preparation plan for it. Find a study buddy that really helps to understand long, lengthy guidelines, and you can have a viewpoint to different questions when you have another person to discuss with. Revise your questions, work on your weak areas. You can make flashcards for certain key criterias, like for LTOT criteria, lung transplant for different diseases, lung cancer staging. Make your mnemonics and try to make it as easy for you to recall and remember. And then go back to curriculum and see whether you are targeting the high yield areas rather than areas where they are not going to ask too many questions. I think that's very, very important. And that's what helped me to crack the exam in first go. That's all from me today. I hope you found this video useful. Please let me know your thoughts, and all the best for your exam. And come back to this video and let us know how you did in your exam. And I'll put the links for the guidelines in the description, and you can check it out from there. Thank you.